Richard, thank you very much, and it is a very great pleasure to be here again at the Royal College of Physicians. As you rightly say, twice in a week is a particular pleasure for me, and on Tuesday, I think it was, I was here with you at the Spokian Health Conference, and taking those two subjects together is a very powerful illustration of the impact and the importance of the professional work being done here by the Royal College of Physicians. So I'm very grateful to have the chance to be here again, and especially pleased to have the chance to be here with you to help launch the network of Chief Clinical Information Officers. I can applaud the progress of the campaign. I think it's a very important thing for us to be doing. It's great to see growing recognition of how clinicians can innovate with imagination and creativity. My vision, as I hope you know, is of a health service increasingly led by clinicians. Yes, putting patients who share in decision-making at its heart, but with clinical leadership at the forefront. Clinical leaders, I know, respond positively to evidence and to data. And as we increasingly harness the power of information, I can see that clinical leadership will use information to transform patient care in the NHS. I've always been committed to putting doctors, nurses and other clinicians in charge, freed from the burden of bureaucracy and from top-down micromanagement, freed to focus on the best interests and how you can achieve the best outcomes for your patients. At the front line of care, in consultation rooms, in wards, in operating theatres, no one is better placed than you to know how to meet your patients' needs. Patient-focused insights are critical when innovating in the National Health Service to improve patient care. Now, making meaningful, up-to-date information available to patients and clinicians and making sure it can be shared securely offers a tremendous prize. More consistent, higher quality, safe, efficient care. That is our vision for the information revolution. Now, I do know many of you contributed to our consultation and I hope you are eagerly anticipating its launch. I'd like to thank you for all your many valuable insights and ideas. It is very important to get it right. I do see the information strategy as very much a co-production with the service. It can't be something handed down from on high. Because as we all know, introducing change as fundamental to the future of the NHS is far from easy, but it is vital to get it right. If there's one thing, of course, we have learned from the National Programme for IT, it's that top-down edicts from Whitehall do not work. The programme often simply boasted about its size. The centre, mammoth, too often remote, dominating the NHS, treating it as it were, the periphery of decision-making. But not recognising that it must, any IT programme indeed, must meet users' needs and would fail to deliver if it did not do so. Imposing national systems that couldn't adapt to local circumstances left the programme shackled with rigid and expensive IT contracts. Contracts which forced doctors and nurses to bend over backwards to fit in with the needs of systems rather than the other way around, at the risk of using the phrase too often. IT is made for man, not man for IT, just as elsewhere in the health service, you know, the tariff is made for man, not man for the tariff, and so on and so on. We must actually ensure that we consistently put patients' interests and clinical leadership at the heart, and then adapt all of these systems and processes to that. We must not be slaves to the process. Unfortunately, what tended to happen was that because IT was seen as being, as it were, handed down from on high and where the process was dictated rather than led by users, IT too often became the enemy. Innovation was stifled, enthusiasm was sapped, real progress was delayed. Now, I know the NHS has, in truth, benefited from elements of the national programme. They have become part of everyday business. The spine, obviously digital x-rays and the transfer of digital imaging, a secure broadband network, the electronic prescription service, albeit not on the timescale we might have wished, the summary care record, albeit that we have had since we came into office, as it were, to reboot the summary care record, and I think we are now making good progress. And indeed, choose and book, which people obviously from time to time have had their difficulties with, but I don't think anybody would fundamentally dispute the need for, and now broadly the place of choose and book. Now, we know all of those. We can move those services forward, and there's no logic in cancelling them. But the programme overall hasn't reaped anything like the rewards you would expect for the time and the money invested. And it has, in truth, been spectacularly overtaken by the explosion in information and technology, which is reshaping the world beyond the NHS. And it's not even that the NHS was in some particular special place where this is concerned, the risk of irritating my friends in the Ministry of Defence. I remember over many years when they were pursuing the Bowman radio system. In the time that it took them to introduce the new Bowman radio system, which I think was, from memory, something like 15 years, the mobile phone industry had been created. Which is why, you know, quite rapidly in places like Croatia and elsewhere, there were service personnel who were talking to each other on those mobile phones. And that has happened in the NHS. So you have the bizarre parallel existence of a consultant using her smartphone to video chat with colleagues and friends across the world, but who spends weeks waiting for patient information to be sent to her by post. Or a GP whose 3-year-old might be playing confidently with his iPad, but whose patients can only make appointments on the phone. But if we're going to close that gap and make that progress, we have to accept that change no longer happens just because someone decrees it. I was very heartened, and it was a great illustration. We ran a competition through the Department of Health to find the best health apps. It's fantastic. We got over some 500 entries, 12,500 votes and comments online. And I was at an event showcasing some of the most popular entries. The examples were terrific. Do go and have a look at some of them. There were apps to track blood pressure, to manage long-term conditions like diabetes, to help people to manage post-traumatic stress disorder, to measure their mood and to be able to adapt and live with it, to look at barcodes on food so they could deal with allergies and so they could buy the foods they wanted and not buy the ones they can't eat. It was just fantastic, the range of applications. And of course, this was about, as we all want to see, patients, in this case, actually often the public, taking control, benefiting from the technology they use every day in the NHS context, not the NHS as a secret garden where the only technology that's allowed in the NHS is the one that has been approved and standardised and homogenised and interpreted by the NHS, but being able to make the application of everyday technology and leading-edge technology something that is an everyday occurrence in the NHS as well. And indeed, doing it not because someone like me, told people to do it, but because it's useful, it's convenient, and it makes people's lives work better. Learning from the revolution that's happening all around us, I think we can now make the leap and shift power decisively from the centre to the NHS front line. So clinicians are in the driving seat, supported by national systems and services only when there is a single clear need across the health service, trusting those closest to the front line to make the decisions they know work in practice. Now, we're already making headway on this. By devolving power, we're on course to make big savings on the IT contracts we inherited from the last government, contracts which were not fit for purpose in a rapidly changing NHS. We're in talks with our largest supplier, the Computer Sciences Corporation, about a new deal, a deal which gives trusts in the North, Midlands and the East freedom to choose which systems they use. And an overriding priority in this is to maximise value for money and to be open about costs and benefits. And I can tell you that around £1.8 billion in overall savings will be secured across the system. Every penny saved will be reinvested back into the NHS. So I'm hopeful we will achieve an outcome that will be good for patients, good for the clinicians, and good for taxpayers. After years of waste and delay, this is a really incredible breakthrough that will free up clinicians in the NHS to exercise control and flexibility. Control over what systems they use and develop, control over the pace of change so it's manageable for staff and patients, and flexibility over how they can build on the best of what they've already got, so systems can be connected up rather than ripped out. But new technology alone is not enough. One of the national programme's biggest flaws from the start was a lack of clinical input. How can you impose systems from the centre if you don't fully involve the people using them? Of course, you can't. People have to be persuaded there's a good reason to change their ways of working, to challenge habits and attitudes. Will it be good for my patients is ultimately, of course, the only question most clinicians rightly care about. And that has been the unswerving focus for pioneers highlighted by your campaign. Pioneers such as Dr. Paul Altman from Oxford University Hospitals NHS Trust, John Radcliffe to you and me, who is here today. His introduction of contactless smart cards in A&E has made it easier for doctors and nurses working under the greatest pressure to deliver quicker, safer care. Before, it was taking too long for staff manually to log in and out of terminals as they moved around the fast-changing A&E. Now, terminals can recognise a clinician's smart card wirelessly, meaning they can easily and securely resume their work wherever they are. Simple, stunningly effective. I'm quite sure I couldn't have devised it, but he did. The new system worked so well because it was driven not by an idea that looked good on paper, but arose from demand from clinicians themselves. A similar story with general practitioners in the North East. Developed clinical dashboards displaying real-time information from a variety of sources. That allows doctors easily to view the latest trends and make comparisons, provides insight into issues like patients' risk of readmission to hospital and prescribing spend against budget. The sort of intelligence which will be invaluable as clinicians increasingly commission and control care. Or Bolton, where similar dashboards have been piloted, there's been a 20% drop in avoidable hospital admission. Now, what is really telling about all this is that, for me, these trailblazers have forged ahead not because they were told to, but because people decided to. They've come up with new, better ways of working based on their evidence and experience. They collaborated with clinical colleagues to understand the challenge and take ownership of the solution. And they've got good support and senior support within their own organisations. So how much more effective is this than a one-size-fits-all approach? How much more confidence does this give suppliers when designing new products and services? And how much more compelling is this as an example to clinicians in other parts of the country? That's why all of these deserve our encouragement to innovate, to share evidence of what works, and indeed to share evidence when it doesn't. A more flexible, agile future for NHS IT will support this. A future where systems can talk to each other so information can be exchanged safely and reliably between organisations. Where GPs, hospitals and other NHS providers are not told what systems to buy, but are intelligent customers in a market which no longer excludes small and medium-sized suppliers. And where national standards are championed where they're needed to underpin local innovation and choice. Now, the NHS Commissioning Board will lead in the future on much of this work. It will make sure the needs of patients and clinicians, rather than technology, drive future strategy, and that services across the NHS are joined up. That will include commissioning and sponsoring the national infrastructure, applications and services, finding the right levers to push the adoption of NHS information and IT strategies, and overseeing information standards and information governance. They will identify and highlight best practice, promote informatics leadership and professional development, just as your campaign is doing. The board will be supported by a leaner delivery organisation, replacing NHS Connecting for Health. That organisation will be responsible for approving and accrediting national and local systems against technical and clinical standards set by the board, so systems can talk to each other. To manage and monitor the day-to-day delivery and performance of key national systems and services such as the spine, and support the delivery of information standards and information governance processes. I say, looking at the way that we're heading now, I'm reassured by the fact that when I talk to my colleagues in many other countries, health ministers in other countries, and we discuss how we are, in our various ways, going about the introduction and diffusion of IT across healthcare system, what I'm describing is what others are doing. And to some extent, they have learnt from what we did painfully, that it is not possible to do very large, top-down, centralised IT systems for very big organisations. The Americans aren't attempting to do it across America. They're trying to connect people up. I was with the Finnish health minister. She's trying to do exactly the same thing in the same sort of way as we are. Now, of course, we're looking at where these delivery functions will sit, and the information centre is an option to house some or all of this work. We will make more progress on the detail in coming months. But we're also developing partnerships with Intellect, the NHS Confederation and the British Computer Society to stimulate a varied, vibrant market of suppliers. On the demand side, clinicians need relevant information to be informed customers and to exercise genuine choice. And our work with eHealth Insider to provide detailed data about IT implementations across the NHS is an important tool to help them draw on the experience of others before they invest in new systems and services. All of this, in my view, lays the groundwork for the crucial shift in culture that the NHS Future Forum emphasised to us needs to happen to make the information revolution a reality. Information has to be seen as it were, the blood flow around today's NHS, as indeed the blood flow matters to us in each of our bodies. The good use of information must be seen not as an optional extra or a luxury, but as a health service in its own right. As we've seen powerfully with the national programme, political pressure alone, however well-meaning it may have been, is not enough to make it happen. The role of government should be to support clinicians to innovate, not presume to tell them how. I remember it was 6 years ago that David and I said, we want to move to a world where we are clear about what we're trying to achieve, but we don't try to tell you how to do it. We need greater transparency. We need to ensure precious insights and learning are tapped into. Data on how services are working is freely shared. Patient feedback in order to shape services. All of those will be essential. Now, I know the NHS boasts a wealth of world-beating talent, ideas and new thinking. It's one of the reasons why I'm so determined on the path that I am, is that actually I know across the NHS we have literally hundreds of thousands of the brightest and best people in this country. And the idea that you would not let them lead and innovate and be creative and enterprising is absurd, because there is so much potential untapped. The challenge in this context is to exploit all that, to ensure that excellence is no longer the exception, but it is celebrated and diffused across the health service so that excellence becomes the norm. So I'm going to say something that you would not normally expect me to say. I am here from the Department of Health, and we are here to help you. To provide support where it's needed, to empower frontline clinicians to lead, to work together with you, and indeed, from our point of view, to work for you in the best interests of patients, together to deliver excellent application of information and information technology in order to deliver the best possible outcomes for patients, which is all of our objective. Thank you very much.